Hello, everyone. Hello, everyone. My name is Deirdre Scott, and I am here extending greetings to you on behalf of the Flint Alumni Chapter of Delta Sigma Theta Sorority and our president, Tamar Swain. We are excited to welcome you to our Black Maternal Health Week Resource Spotlight. Whether you're watching along in the live stream or watching the replay, you're in for a treat. We all may have heard about the fact that Black women in America are nearly 3 times more likely to die during pregnancy or delivery than any other race. There are many disparities as it relates to maternal health outcomes before, during, and after childbirth that can impact the mother and child well into their later years. We're going to use our time today exploring solutions that can help close that gap in maternal mortality and resources that give Black mothers and children a better start. According to research, in addition to essential interventions in the healthcare system, there are community-level resources that can help Black mothers. Programs that focus on financial stability, social support, breastfeeding support, and mental health resources have all been shown to be positive and beneficial. Stay tuned to hear about 3 essential resources that we have here in Flint. These are Black women that are making a difference for Black mothers because they are Black mothers. They work in their calling and in their purpose, and they do this for their living. Whether you are local to Flint and want to be informed to sign up or spread the word about these resources, or from another community and want to be inspired to take action, we invite you to stay tuned and listen. Feel free to add questions to the chat, and we will save the questions after and begin to answer them after all the presenters are done. Our first presenter is social worker, advocate, and therapist, Chia Morgan. Chia Morgan is a lifelong resident of Flint, Michigan. She is a tireless advocate for social justice, violence prevention, mental health awareness, and self-care. She holds a Bachelor of Social Work and Master's in Public Administration from the University of Michigan. In 2022, she obtained her Master's in Social Work from the University of Denver and is currently a clinical therapist. Additionally, she is a program coordinator for a nonprofit organization, Well of Hope, through which she created the Blessing to Be a Blessing Thanksgiving dinner for less fortunate families. She also created the Boxes of Hope, which are 4 outdoor food pantries located throughout the city that are free and open to all. Chia is currently a member of the Neighborhood Small Grants Committee for the Community Foundation of Greater Flint, the DEI Commission for Genesee County, and the National Association of Social Workers, Michigan, as their secretary. She is also a member of Zeta Phi Beta Sorority Incorporated. In her spare time, she's a public speaker, notary public, human trafficking trainer, and mentor. Her most important and favorite title is mother to her 11-year-old daughter, Malia. Chia says that she is nothing without God and would sum up her life with Jeremiah 29:11. Chia.
Thank you. I am honored to be here. I appreciate you all for extending me the invitation to join you with such an important topic to not only myself, but our community and our country as we face a national maternal health crisis. So we can jump right in. Alrighty, so as she stated, my favorite and most important title of my bio is Mother to my daughter Malia. Additionally, I am a community activist. I'm a social worker and I am a clinical therapist. So I want to start out today talking about my favorite part of my bio, Miss Malia. All of these are pictures from when she was first born. And so we think of birth as an amazing time, an exceptional time, but it is probably the first time that I realized the importance of addressing maternal health because I, as a social worker, as a community activist known in the community, I had to advocate for myself in the hospital. And so today we'll start out with me sharing a story that's funny now, 11 years later, but it was not funny at the time and it's not funny to the mothers who continue to experience these type of disparities in childbirth. And so the aide that came in to prepare me for my discharge, she immediately came in, no greeting, asked me for my Medicaid card. And she was snide, she was short, she was rude, and she was also a Black woman. And I told her that I didn't have a Medicaid card, and I handed her my Blue Cross Blue Shield card. And instantaneously, her mood changed. She began to share resources with me. She brought me pre-made bottles. She gave me a knit hat and booties that were made by hospital volunteers. And, I was thankful because my mom raised me right. When someone gives you something, you say thank you. But I was outraged because the color of my card literally determined the care that I was given. When she assumed that a young 26-year-old mother had Medicaid, I wasn't given the bottles. I wasn't given the items that the volunteers made. She wasn't asking questions about the baby. It was more, give me your card and let's get you out of here. And so while I was on maternity leave and I had promised my family, friends, and community that I was going to take a break from activism, it was activated right there in that hospital. I had to go from maternity leave to not only advocating for myself, but any young mother that could be coming behind me. And so while I was breastfeeding, she never even inquired about that. She just began to unload those pre-made bottles for me to be able to take home for Malia. And so as I thought about that, I realized we are in crisis here because there was no conversation, there was an assumption. And if we're doing this at the discharge, I can only imagine what mothers are experiencing when they're making complaints about pain in the childbirthing, or if they're saying something just is not right. We can go to the next one, Miss Deirdre. And so as my, activism was activated because the difference in Blue Cross Blue Shield and Blue Cross Complete, or the perception of that, determined what I would get. It was important for me as a social worker to let that kick in. We keep going. And as we talk about counting up the cost of what this is for our community, the therapist and the social worker kicks in there. So what we previously called postpartum depression is now categorized as a perinatal mood disorder. And they are one of the most leading complications of pregnancy and childbirth. That alone is enough. 1 in 7 women will experience some part of postpartum. However, as startling as those numbers are, Black women are 3 to 5 times more likely than their white counterparts to die during childbirth. And that is because of stigma. That's because of the financial barrier that I almost experienced while I was going through discharge. That is because of involvement in the child welfare services, as well as the stigma associated with trying to advocate for yourself and possibly not knowing how. And so as we go and talk about being a proud member of Zeta Phi Beta Sorority Incorporated, we have an initiative with the March of Dimes that helps these women who are 3 to 5 times more likely to experience these things. Black women, 40% of them who have childbirth experience some form, of maternal mental health symptoms, and so 60% of pregnancy related deaths are preventable. So Zeta Phi Beta has the Stark's Nest program, which helps us reach out to mothers. It helps us pour into them by making donations and connecting them with services in the NICU, out of the NICU, and in the community. And so I'm very proud to be able to provide that resource to families. Additionally, there is can you back up 2 slides for me? There are resources here in Genesee County that help us mothers, help those who are going to be mothers to prepare for childbirth. And that is the YOLO program, and that is you overcome lactation obstacles. And they not only provide support with breastfeeding. I know when I had Malia, again, advocating for myself, I was having issues with her latching. And so it was hurting. It was making me want to give up before I even left the hospital. And I remember calling my nurse that was with me in the delivery room and saying, I need help. When we talk about these babies who are underweight or failure to thrive, because of that stigma that follows them from the birthing room, there is often, I'll just give up. I don't know what to do. I don't know anybody that can help me. I can't afford to pay for breastfeeding support and services. And so YOLO helps with lactation classes. It provides support to the caregivers. One of the other um, benefits to this program is that mothers may not have a big support system, but they may have their grandmother. And as we know, things change over time. Terminology changes, what's safe for the baby changes. And so this program helps to educate the caregivers so that you're able to feel safe taking a break, taking a nap, so that if you are experiencing any perinatal symptoms, also known as postpartum, you're able to say, I'm giving this to my baby and I don't have to worry if they're safe. There's childbirth education classes, there's childbirth refresher classes, and it's just an overall support for the families. There's Woo Mama, who is providing community resources, community baby showers, gathering those resources to help mothers who just don't know who to turn to or where to go. And so it's important that these mothers have not only somebody to fight for them, as they are 3 to 5 times more likely to experience, a maternal mental health crisis, but resources to help them overcome these perinatal disorders that really affect them as they are trying to raise their children. And so we want them to be able to have tangible situations, tangible supports, tangible services. And so outside of Stork's Nest, Woo Mama, and YOLO, we also want to make sure that we're letting people know that therapy is available, and not just any therapist. We want a therapist that's relatable. We want a therapist that's culturally competent. It's no good to go to someone who won't acknowledge the Black maternal mental health crisis that we're dealing with. And so it's important that you have somebody that's specialized in either postpartum depression or perinatal health and are able to say, hey, that's not my specialty, but I can get you to somebody that will really, really help you, someone who is keeping up with postpartum resources. And so people may say postpartum, it's really not that much. She's just sad after she has the baby. One of the things that we have to consider is Andrea Yates. She murdered her children in 2001, and it was a known case. She drowned them in the home. But when you look at Andrea Yates, she'd had postpartum after all of her children. The symptoms that led to her postpartum psychosis, that led to the murders of her children. It actually started in 1999. And so we have to take postpartum serious. We have to give a voice to our mothers after childbirth. We have to rally around them and make sure that they're getting that physical and mental health that they need. I happen to be a therapist that specializes in postpartum depression or a perinatal disorder. And so here on the screen, you see my contact information on how to reach out to me. There are those in my practice who also reach out to that. So if you say, you're not the therapist for me, Chia, we're too close, there are others who I'm elated to connect you to, because we have to be able to all reach out into this crisis and say, enough is enough. And that is my time.
All right. Well, thank you, Chia, for sharing such a personal story from your past and using that to help others.
Thank you. My pleasure.
Mhm. Our next presenter is Soror Katrina Tillman from Revive Community Health Center. Katrina Tillman is the executive director of Revive Community Health Center, an integrated center that provides solutions to structural inequities and health disparities to Flint and Genesee County residents. Being a mother to four sons, Katrina knows firsthand the challenges women of color face pertaining to maternal and infant health. Having her own personal experiences coupled with the national statistics of Black women being 2 to 3 times more likely to die giving birth, according to the CDC, Katrina saw a need and created a solution. The Revive Village program is an integrated approach to case management that focuses on the education and advocacy of pregnancy while producing positive outcomes for mothers and children. This state recognized program has aided in decreasing the local rate in maternal infant death. And I also want to say that Katrina Tillman is a proud member of Delta Sigma Theta Sorority Incorporated. Soror Tillman.
Good evening, everyone. Thank you, Soror, for the amazing job that you're doing and the work that all of our sorors are doing in Flint Alumni Chapter. I am just so honored to be here to speak about the work that we're doing at Revive and to also shine a light on maternal infant health. As we all know, today is the first day of Black Maternal Health Week. So this is a great way to start getting more awareness surrounding this crisis. So let's go ahead and get started. As she stated, my name is Katrina Tillman. I am the executive director at Revive Community Health Center. We're located downtown Flint, Michigan. I am married to my husband, Reverend Dr. Ezra Tillman, of 16 years. We have 4 beautiful sons, age range of 15 all the way to 6. And I am a proud member of Delta Sigma Theta Sorority Incorporated. I know far too well, obviously, what it is to be a mother, the stresses that comes with motherhood, and then unfortunately having my own experience of not feeling heard. And so this is very near and dear to my heart. I wanted to start off with giving some statistics. I know we know nationally that this is a crisis, that Black women are 3 to 5 more times likely to die giving birth other than our white counterparts. But let's look at our backyard. So in Genesee County, the average hospital cost is around $76,000 for low birth weight versus around $3,000 for a normal birth weight. And that is Flint and Genesee County low birth weight rates are higher than 93.9% of all Michigan counties. All of this information is founded within our Genesee County Community Health Needs Assessment. They do it every 2 years. So this is from 2022. Also in Genesee County, 14% of African-American babies do not live to see their first birthday. Now, that's Genesee County. Let's look at Flint. In Flint, Michigan, the infant death rate of Flint, Michigan is more than double of the entire United States. This is a crisis that unfortunately our community know too near and dear. because this isn't something that just started for us. This goes back to slavery and the different things that we've had to deal with as Black women. And it's unfortunate that we're still facing some of these statistics today. Can we go to the next slide? So knowing that this is a real issue, that this is not just something that only affects, on a national level, that this is happening right in our backyard, right in our neighborhood. In lieu of the water crisis, myself and my husband, we founded the Revive Community Health Center to bring about some type of resolve and to be a part of the solution in this particular space. So Revive Community Health Center, we provide wraparound services to expecting mothers in the Flint and Genesee County area to help mitigate and decrease the maternal infant mortality rate. You can go to the next slide. So our motto is very unique. When I was contemplating how to really serve moms, I really wanted to make sure that this was done in a very tangible way. And so when we say wraparound services, you will see exactly what this model really means. So our moms are given a life liaison. For our community, words matter. And so while the life liaisons do work that is similar to a case manager, sometimes certain words can have a negative connotation. So we use life liaison, but they do very much similar work. They help moms matriculate through our program, as well as connect them with other community partners that service local moms as well. They also are required to participate in our Baby Bucks workshops. These workshops allow our mothers to get educated on all things pregnancy, from breastfeeding, nutrition, the different tests that they have to take when they go to the doctors. What Revive Village does is we stand alongside the providers because, as you know, when you go to the doctor, they don't have a lot of time to spend with you to educate you on what's going on. They have to have you in and out. They got to take the test. And sometimes you have questions that you want to be able to get answered. And so what we do is we make sure that we educate our moms on the questions that they have concerning their body during pregnancy. And we also ensure that we teach them how to advocate as well. That's something that we're really big on, that you'll see in a few more slides moving forward. We also have mentor moms that, as they matriculate through our program, our moms that come out of the program return back as a mentor mom. And as I stated, they are highly incentivized as they complete their workshops. So the more workshops you complete, the more baby bucks these moms receive. And the baby bucks that they get, each workshop is worth $25 in baby bucks, which allows them to come into our center and shop for brand new baby products for free. I forgot to mention our program is completely free to Flint and Genesee County moms. So the more education they receive, the more baby bucks they receive. Then we get to offset some of that cost. As we all know, motherhood, parenting by itself can be very expensive. And so what Revive does is we kind of stand in the gap on the financial side as well to really set the mom up for success by supplying her with up to 3 months worth of brand new baby essential products as she matriculates through the program with those baby bucks. We can go on to the next slide. This is just to give you an idea of what our process looks like. We receive referrals through several different community partners and Facebook, believe it or not. A lot of our moms come from Facebook. Like I said, they're assigned a life liaison. They have to participate in our Baby Bucks workshops. While our program is free, participation is required for our moms to maintain their active status in our program. After the mom delivers her healthy baby, we also focus on maternal mental health with our Woo Style segment. And this is our second leg of our program. These are 2 30-minute sessions that our moms receive. And as a result of that, they receive $100 in baby bucks by completing both of those sessions. Again, allowing the mom to come back into the center and shop for boppy pillow. We have everything in there from car seats, boppy pillows, diapers, all of the essentials that a mother would need going into motherhood. The final part, well, not the final part, but the other third leg of our program is the Mommy and Me. And this is for our mommies that delivered. This is more focusing on parenting workshops. We also do some financial literacy, job readiness as well. And we're also getting into some credit repair workshops for our moms to participate in during the Mommy and Me portion. And as I stated, we're entering into our mentor mom program segment, where those moms who have matriculated through the program come back if they're interested in being a mentor mom to new moms that's entering into the village. Next slide. So here's some impact that we've had. Revive has been around since 2020. I heard Chia mention one of our key partners, YOLO. Shantae has been with us since the beginning with 2020, and she does a lot of our workshops with breastfeeding and maternal education as well. We've received in 2020 to 2023, we received 224 referrals. We enrolled over 150 moms, and we are excited to say that we had 146 healthy, thriving babies, village babies, as we like to call them, come through our program. And because each of our moms are required to take a minimum of 4 workshops, we have up to 15 workshops that we offer. Each mom has to take a minimum of 4 workshops. Last year, we completed 572 total workshops from our active moms. Next slide. So our motto is, it takes a village. We know this is the African proverb, and it truly does take a village. I've been blessed, my husband and I, to shout out to any grandparents that's out there. You all are truly a blessing. And so we truly understand at Revive that it does take a village. This is not a one-man show or one-woman show. There's so many plethora of resources, and I'm so glad that the Flint Alumni Chapter is taking the time out to highlight organizations in the community that is actually doing the work. And so these are some of our key partners that we've partnered with throughout the years to aid us. We can't do it all, and so sometimes the need of the mom is maybe out of our capacity. And so we are always looking to expand our partnerships as well. Next slide. Oh, this is my favorite. So as I stated, we are one of the things that really makes Revive unique, because we understand Black maternal infant health, that advocacy is very important. Teaching our moms how to advocate for themselves, teaching them what signs to look for with their bodies, and making sure that their voice is heard, because the truth of the matter is that while you may not be a doctor, one of the things that we tell all of our moms is that you are the expert of your body. And so your body speaks to you before the doctor knows anything else. And so if you feel that pain, and you need to be able to communicate that to the doctor in a way that is effective and efficient, so that the matter can be taken care of. So we really take advocacy very, very important at Revive. This week alone, we had a lobby day up in Lansing on Tuesday. We were able to take some of our moms to advocate not only for themselves and our work that we do, but they were actually advocating for moms they don't know that will eventually enter into the Revive Village. We've also today, we had a press conference with the Biden campaign. They reached out to us to host a press conference to kick off Black Maternal Health Week. And we also took great pride in 2021, making recommendations to the White House administration, to the Biden-Harris White House administration regarding the Omnibus bill. I encourage each of you all to look that bill up, and there's much work to be done there, but it's a great piece of legislative work that we have a couple of pieces that still need to get passed. And I'm glad to say that some of our recommendations, along with other organizations across the country, were added to that actual bill. And we also actually have an advocacy summit coming up this Saturday to continue our work and awareness in Black maternal infant health. Next slide. So this is some testimonials. It's one thing we always say, it's one thing to hear from us about how amazing this work that we do and how great this program is. It's another thing to hear directly from the moms. And so we make sure that we take heed to the voice of our moms very seriously. All of our workshops are broken up into tiers, and each tier has a survey. And we have been able to, myself and my amazing team, we've been able to take this information from these surveys and continue to develop and cultivate and shape the work that we do at Revive. And so we are excited to get that direct feedback, to hear the voices of our moms, and to hear some of the new ideas that they may even have in terms of new workshops that they would like to partake in, or certain areas of interest. Next slide. So myself personally and my team, we're very big on community outreach. We can't say that we're a community health center and we just stick to ourselves, right? So community outreach is important. And while our program is free, we want to make sure that we extend our doors open to the community, to expecting mothers in the Flint and Genesee County area. And here's just an idea of some of the things that we've done in the past. We've done a literacy workshop. As I stated, we took the Momney Bus bill, and we wanted to continue to shine a light on it and awareness regarding the actual bill. So we partnered with other organizations to do a Momney brunch to bring more awareness to that. One of the things that our moms look forward to every summer is our Mommy Day Off Camp. This is for our moms who are expecting, but also have additional children. Me being a mom of 4, I know all too well what it is to get a break. And just have maybe, 3-4 hours to myself if I need to sleep, do some cleaning, or do some grocery shopping. And so we do a Mommy Day Off Camp at the center where the moms can drop off their children for a couple of hours for 2 weeks. And we partner with other local organizations such as the food bank to feed the children. We've also done Brunch and Bucks. That's kind of like our lunch and learn, where we have different partners come in to focus on either safe sleep and things of that nature. And moms are able to receive those baby bucks in hand and go downstairs and shop in the baby bucks room for those brand new baby products. So how do you enroll? You reach out to us. Like I say, we're located right downtown Flint, Michigan, 1221 Beach Street. Like I said, a lot of our referrals come through Facebook. We also have referral partners is Hamilton, CHAP, and a couple of other organizations reach out to us, excuse me. But simply email us. Like I said, the requirement to be a part of our program is you have to be currently expecting 30 weeks and under and live in the Flint and Genesee County area. That's it. You can join the village. We actually have open enrollment going on right now. So if you know any expecting moms and you think that this program would be fitting and suitable for them, we would love to serve them and take them into our village. You can reach out to us. Thank you.
Well, thank you, Sarge Tillman, for your information, all of your statistics, and just bringing and shining a light on the impact of slavery that still goes on in the Black community and how it is manifesting today. There is a really lively chat that's going on right now, and any questions that anyone has, if you can just drop that information into the chat, we're going to save all questions till the end. Make sure that you indicate which presenter the question would be for. Our next presenter is Dr. Kenyatta Dotson, and she is from the program RX Kids. Dr. Kenyatta Dotson is the Director of Community-Based Implementation and Engagement for Michigan State University College of Human Medicine, Charles Stewart Mott Department of Public Health. She's the co-chair of the Community Advisory Board for the Flint Registry and leads the Pediatric Public Health Youth Advisory and Parent Partner Council. Dr. Dotson has over 30 years of experience in the field of community outreach and engagement. She's a lifelong resident of Flint, Michigan, and is deeply rooted as a community leader, connector, and organizer. Kenyatta strongly believes in collective action and citizen responsibility at every level. It is for this reason that she advocates and serves on behalf of our smallest and most valuable citizens at the local, state, and federal levels. Her work is dedicated to bringing about systematic change to increase the presence and relationship between people, partners, and community-based programs, regardless of our differences. Dr. Dotson has been employed at MSU for 5 years, working in collaboration with Flint youth, families, and partners, developing projects and systems to inform, elevate, and build sustainable partnerships that work to the advantage of all people. Her favorite quotes are, "Change begins with me," and "Everybody is somebody." Dr. Dotson.
Thank you. Thank you so much. Thank you for that introduction. My sisters and colleagues have talked a lot about the data, and they've spoken to some of what I was going to speak to as well. I was going to mention, which I believe Chia and Katrina both mentioned, that Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women. And what I want to point out is most of these deaths are preventable. And so the heightened risk spans all educations, all incomes as it relates to Black women in general. And so it's just really important that that this high risk rate of maternal health as it relates to Black people, that we understand that it doesn't just happen overnight. It didn't just happen overnight, but it happens because there's systemic racism that's in place, that's embedded into our systems, where Black people don't have access to certain things, certain health-related issues, health-related services, food and housing issues, and things of that nature. Black birthing people are more likely to experience life-threatening conditions than any other person. And these are things like blood clots or a postpartum hemorrhage. Something like that should be easily repaired, fixed, but because of the amount of things that's piled against Black women as it relates to mental health, maternal mental health, and maternal mental healthy outcomes, a lot of times this becomes very difficult. So I just wanted to point that out before we got into the discussion, because I think that's really important. We still have a lot of work to do in terms of bringing about equality, equity amongst Black women, particularly those who are with child. So I just wanted to mention that. I'm going to share my screen at this time. Okay, can everyone see it? Can everyone see it?
Yes.
Yes.
Okay. All right. So this QR code here, and I can bring it up later if anyone needs me to. This will take you directly to gain more access to RX Kids. RX Kids, we have wonderful partners, and these partners have been very instrumental in helping to bring RX Kids to light. That's Michigan State University Pediatric Public Health Initiative, Hurley's Children's Hospital, the Poverty Solutions, and I'll go here to this slide, Poverty Solutions, Give Directly, and the Greater Flint Health Coalition. I do want to point out that Give Directly, this is so amazing. When we were first introduced to this concept and they said that there was an organization that just gives out money, I'm like, what? I've never heard of such a thing. So Give Directly is one of the first and largest nonprofits that sends money directly to people living in poverty. So I just wanted to mention that because this is just absolutely amazing. And then for those dollars to come with no strings attached. There's no mandate for you to do X, Y, and Z, but there's absolutely no strings attached for the moms to use the money how they see fit to better help their families. Throughout the agenda, I'll just go a little bit about the background. I'll show you a little bit about the design, evaluation, talk a little bit about the funding, and then the eligibility and enrollment. So RX Kids, again, is one of the first ever citywide cash prescription programs for pregnant moms. First time ever. Just to give a little background, there has not been another that gives cash at the amount that we are giving cash to moms and babies. And we understand that by helping moms during pregnancy, especially throughout the first year of baby's life, increases their health outcomes significantly. So at this time, this is why through this program, we decided to prescribe a prescription for health, for hope, and for opportunity. So we're taking away the Band-Aid completely. No more Band-Aids, no more quick fixes. We're going directly to the root of the problem moms face relative to poverty and other systemic issues that perpetuates the stronghold and oftentimes the generational cycle of poverty. So RX Kids is certainly a vehicle for equity and opportunity. We're truly trying to lift moms, babies, and their families out of the system of poverty.
Dr. Dotson.
Yes.
Could you hit up in the upper left-hand corner from current slide? If you, yep,
Okay.
right there.
Okay.
Yep, click that. Okay, thank you.
Thank you. That's very helpful.
Uh-huh.
Okay.
No problem.
All right, so many of you may or may not know, but Genesee County is deemed one of the most unhealthy counties in Michigan. We're not proud to say that, but we're definitely working to change those outcomes. And some of you may also know that near the birth of a child, the family income significantly drops. So the income, and I have a chart, the income can be somewhat high, whatever that high dollar amount is. But when it comes to having a baby, the income drops significantly. Moms are struggling with the little that they have. They now have to provide the need for the new addition that's on the way, oftentimes spending money that they don't have. So to talk a little bit more about that, Flint being one of the poorest cities in the state, and I don't like sharing this type of data because I know as Flintstones and Flint residents, we're working to change this narrative, but right now is deemed one of the poorest cities in the state. And 70% of our children live in the rate of poverty. 35% of all Flint citizens are in poverty, and 70% of our children live within that poverty as well. So this is the slide I was telling you about. So the family income significantly drops at birth. Significantly drops at birth because a lot of times people are living paycheck to paycheck. They don't have the money that they really need to do some of the things that they're trying to do, especially living in an impoverished community. But with RX Kids, we're hoping to change this around. Now, in the city of Flint, roughly 1,200 babies are born every year. Presently, RX Kids is just about at its saturation mark. What I mean by that is And I'll show you in just a moment. Nearly every mom who is pregnant in the city of Flint has enrolled or been reached out by our team, and they plan to enroll. So things are looking pretty good at this point in time. And then this just shows, again, the dollar amount for every mom. The only requirement is that you live within the city of Flint and you have a baby born in the year of 2024. And when that happens, moms receive $500 every month, and they receive $1,500 mid-pregnancy, for roughly a total amount of around $7,200. And these moms come into Michigan State, where I work, and they sign their paperwork in order to get their debit card or to get their money direct deposited. And oftentimes when they come out, they're smiling, they're so happy. I'm like, what are you going to do with your money? They're like, I'm going to pay this bill. My consumers is behind 3 months. My card note, I thought I was going to get repossessed. I haven't taken my kids out to dinner in probably 2 years, or to a movie, or to some type of activity. So we're going to do something like that. So moms are truly using the money to benefit their families. And some are just putting it in the bank for a rainy day. Mommies are parent partners. Our moms are parent partners. The moms that you see right here, these have been mom consultants. We've been working with them since October. Many of them were just finding out they were pregnant or were a few months pregnant. And they review surveys, they review questionnaires, applications, and other important documents before it hits the community, before we send it out to our moms who are enrolled in the RX Kids program. They provide their voice and they give us their feedback. And so we're very happy to have these mom consultants on the team. Whenever we need an interview, they're going out for interviews, they're speaking on our behalf, they're telling their story, and they're doing a phenomenal job. So again, this is what I talked about earlier. There's no income requirement, absolutely no income requirement. As long as you live in the city of Flint, then that's fine. And there's no strings attached. Nobody's telling you how to spend your money. And I want to also mention that this is a gift. This is a gift to moms. So we will not impact most other benefits, and it will not impact most other benefits. So when you talk about MDHHS, when you think about the EBT card, this $500 a month will not interfere with any of that. So this is just additional money that they can utilize for their families. This is the funding part. So I love explaining this part. So for the program, it's going to be about $11 million a year. $9 million of that goes into cash transfers directly to the moms. 1 million goes into operations. 1 million goes into evaluations. For a total of 55 million for 5 cohorts. Now, this is our first cohort. So we hope to do this 4 more times after this year. And again, it's the largest cash transfer program in the country. This says to date about 41 million have been committed from community, but we've increased that number to 43 million. So I think that's something to be really happy about. Also, just want to share with you just the eligibility requirement. I've already talked to you about this. Resident of Flint, pregnant as of January 2024 or later, as long as your baby is born in 2024. And the infants must be 6 months of age or less. If your baby gets beyond 6 months, you more than likely will not be able to qualify for the program. That's why it's so important to get this information out to pregnant moms now rather than later, so that they can make sure to take advantage of this benefit. All right. Just wanted to show this. So when the child tax credit came about, we saw a significant decrease in poverty and families struggling. And when that tax went away, things just kind of went back to normal. And that's why we wanted to come up with the RX Kids program, so that we can make sure that we can do all that we can to pull and lift moms and babies out of poverty. And then this just shows a little bit in addition to what I already talked about what moms are spending money on. So when we first started this program, there was a lot of people saying, well, you need to have some type of guidelines about how they're going to spend their money, what they're going to do with their money, and things like that. We decided not to do that. This money is for them to utilize. And for the most part, what we've heard, moms are utilizing the money to benefit their families. All right. This here, sorry. This here, now these are not stock photos or videos if we ever show a video. These are actual moms who are actual partners of the program. So this mom here, she is very active in the program. And we just want to say that we're promoting child development and lifelong health and success. We're working very hard to reduce maternal infant health disparities and also to prevent, I don't know why I keep doing that. Also to prevent poverty to the best of our ability. All right, now this is another chart that I wanted you to see. The youngest children are the most vulnerable to maltreatment. And as you can see here, when a child is one, the number is incredibly high. And then as a mom is pregnant, and then when they become one, the numbers tend to trend downward, but they are most vulnerable at the youngest age. And this shows as soon as a baby is born, that's when they're most vulnerable. And I believe Chia or Karina or somebody mentioned how many children die within the first year. So this shows you and kind of confirms those numbers. Just in case you want to reach us or for more information, here's a QR code if you can scan it. I don't know if we're going to send these PowerPoints out, but you can most certainly have this one. To get in touch with RX Kids, it's flintrxkids.com is the website, and you can get all the information you need from that particular website. If you need support, if you're already a mom who's enrolled or have been trying to enroll and you're having some problems, please reach out to customer service. Their number is listed here as well as the website. All right, and how can you help? You can help by spreading the word. You can help by talking to your neighbors, talking to your colleagues, talking to your church members, talking to your family members. Share RX Kids with everybody that you know and direct them to the website. If you have the customer service number, if people need help, direct them to the customer service number, and all the information they need can be found on the website. And again, these are not stock photos. These are actually moms who are at the table helping every step of the way, utilizing their voice. These are some of our awesome partners. At the beginning, I showed the partners who really helped to get everything moving. These are our funded partners who have provided significant dollars in order to help us to get to that $43 million mark, although we still need a little bit more money in order to get to the $55 million mark. But these are some of our value partners who have helped during this quest. And then these are some of our community partners who have contributed as well. And there's so many more people who have helped, from community to local, state, and federal government, Republicans and Democrats. Everybody is truly working together on behalf of our most vulnerable families and children. Here's a few more. And that will do it for me. I would like to say you can find us on Facebook, you can find us on Instagram, you can go to at Flint RX Kids, and you can find a host of pictures there. But with the last few minutes that I have left, I would like to introduce Tatiana Lopez. She is a parent partner, and she's also enrolled in the program. And I would love for her to be able to speak briefly, just to share from a personal standpoint.
Good evening, everyone. How are you? So I'm a mother of 3 boys. I have a 13-year-old, a 7-year-old, and a 2-month-old. My youngest child was born January 19 of 2024. Prior to his arrival, I was not aware of what RX Kids program was. I actually found out through my mother-in-law on January the 10th. She said, "Hey, have you applied for the RX Kids program?" And I texted.
Tatiana, you put it on mute by mistake.
I'm sorry.
We can hear you now.
Where did you hear me? Where did I end up at? Oh.
Only about 10
Your
seconds.
mom.
Oh, my mother-in-law sent me a message and said, "Hey, have you applied for the RX Kids program?" And I told her, I texted her back and I was like, "No, I don't know what the RX Kids program is." She said, "I heard it in the news. It's something for you to look into." So I Googled it. And that was January 10th. And I think January 10th was the date the application became available. So that evening I researched it and I was pretty confident that I qualify because I do live in the city of Flint. And so I applied and I submitted the application that evening. And maybe about a month later, I received the first payment. I feel like RX Kids has put my mind at ease because I did go on maternity leave. And, when you are on maternity leave, you are not bringing the same paycheck as you were before. So with RX Kids, sending the payment, I was able to stay, I'm able to stay on top of the bills that keep flowing in. And I'm able to provide what's necessary for my children. I'm able to, one of the things that I did use the money was from one of the things that I used the money was for fixing my car. I needed new tires and I needed new brakes. So I was able to get all that done within the last few months. And I'm just thankful for this program, and I'm thankful for Dr. Mona and everybody that made this program happen.
Thank you so much, Tatiana.
Thank you.
We'll turn it back over to the team.
All right, thank you so much. I just want to say that is certainly such a benefit and a blessing. That program is phenomenal. I want to say thank you to all of the presenters, to Chia, Katrina, and to Kenyatta for bringing us such insight on this healthcare crisis that we're experiencing here in this area. And with that, I got some messages while you all were speaking in regards to questions, and it seems that there was a very lively chat going on, but that you all had people that were very aware of your programs and were answering the questions as they were popping up in the chat. So I'm not going to go back over those questions that were answered. We had someone monitoring the chat, and it seems that you all have covered all bases with that. But what I'd like to ask all three of you, I'm going to ask it once unless you need me to repeat it. And maybe you can speak a little bit about what the future vision of your organizations will be within the next 5 years. What do you hope that your organization grows into or morphs into over the next 5 years? And we'll start with Kenyatta, then Katrina, and then Chia.
Thank you for that question. I think over the next 5 years, the future and the vision of Michigan State University Pediatric Public Health, which deals with the public health of community, the public health of people. We want to continue to connect people to resources. We want to continue to be a good partner. We want to continue to make sure that people have the best health outcomes possible by the data that we are gathering. And we want to continue to share that information because People perish from lack of knowledge. We want to make sure people are very well informed about what's going on with their health because of the lead that exists within our bodies for those of us who are within the city of Flint. And we especially want them to know how to support their kiddos, how to support their babies who were most impacted because most of them were 6, 5, 4 during the time of the water crisis. So we just want to continue to be a great partner, continue giving out the information that we provide, and to continue making those connections.
Thank you for that. Katrina?
Yeah, thank you so much, Soror, for that question. At Revive, our future looks bright. It's unfortunate that we have to do this work, but as you know, the work has to get done. And so we are looking to get into housing. A lot of our moms are displaced. And so we know that that is an issue and a concern for our moms. And these are stress factors that weigh on the mom during your pregnancy. And so one of the things that our life liaisons do is help mitigate that stress. But if you're a mom and you have, let's just say, this is your first child and you're considered homeless or couch surfing or living with a friend, that's stressful. And we want to be able to decrease those stress factors. Another thing that we are currently doing that will continue to speak to the future of Revive is we will become an easy access clinic. And this is a specific accreditation that we're in training. Myself and my team is going through the training process of that right now. And this will allow us to walk alongside even closer to our OB partners. For instance, moms will be able to come into our facility and receive, get their blood pressure checked, maybe do a glucose test and actually matriculate through our program, but also get somewhat into the health aspect of it as well. But while also ensuring that they return back to their OB doctor during their 6-week checkup. That's a concern that a lot of moms, after they have their baby, they are not returning back to get that 6-week wellness checkup. And during that time frame, that's when a lot of these health concerns can happen. And so we're looking forward of receiving that accreditation at Revive. We're currently deemed a safe spot, a safe place. Which it's just another way of saying that this is a safe space for moms to come and enter into. But the housing thing is definitely of great concern, and we're looking forward to just better serve our moms. This came directly from surveying and getting that feedback directly from them. So when our moms speak, we listen to them. We can't teach them about advocating and we don't listen to them. So we make sure that we take heed and take to heart of their personal concerns and try to figure out a way that we can structure and or partner with other local organizations to meet the need.
Thank you, Katrina. Chia?
Alrighty, so in a perfect world, my answer would be that we would not need to have moms in therapy, but we know that that's not the way that things work. So in 5 years, I would really love to be able to see us getting more information out. So programs that are designed like those that have been spoken of today to help moms understand you don't have to just sit back and take whatever's going on, whether that's in your OB appointments, whether that's in the birthing room, whether that's when you are being discharged. And so I've always said that I'm ineffective as a therapist if I'm not willing to step in, do a little case management with those who I serve. And so in 5 years, I really hope to be able to provide resources to those who are seeking those services and reaching out to mothers, breaking the stigma, not only of seeking care, but breaking that stigma of mental health and advocating for those mothers to go to therapy and talk about it, because birthing in itself can be a traumatic experience. And then when you add on the statistics that we've talked about today, our mothers are not equipped to be able to have thriving babies. And so that's what I like to see in the next 5 years is lots of advocacy and mothers going and pulling back some of that trauma that they've experienced from this unfortunate public health crisis that we're faced with.
Thank you for that. It seems that with the three of your organizations and your programs, that one of the great messages that you're putting out there also for mothers is that you're not alone. Um, there's a component of community that is involved in what all three of you have said. So thank you for that. Another question is resources that are needed. How can people support you? There were some questions in the chat, and people were overwhelmingly asking for more information about your programs and how they could help. We did have a medical student at Hurley who was she or he works in labor and delivery unit, and they wanted to know how to make referrals and how to get involved with referral processes and what type of documentation and paperwork was needed. Again, that question was answered, but if there's any additional information that you can give about resources or how to interact with you best, we'd appreciate it.
So for Revive specifically, because I am far too familiar with our target audience, we service all expecting mothers. I want to be clear about that. But because this is an issue and a crisis that, unfortunately, as I stated, Black women are still facing since slavery, I'm very intentional. And my staff and my team we're very intentional of how we service our moms. And so one of the things that we are always in need of is brand new baby products. We do not take gently used products simply because I want our village moms to know that they are worthy of brand new products. And so we're always in need. We have a very beautiful facility. And our lower level, there's our actual baby bucks room. And as I mentioned earlier, that room has to stay, filled with products because that's how we incentivize our moms. So we're always in need of diapers, wipes, car seats. Next month for Mother's Day, we're looking to get a donation of at least 50 car seats. We are always in need of car seats, pack and plays, boppy pillows, breast pads, and milk storage. Any baby product, essential product, brand new, Revive is always in need of. So if other local organizations are looking to get involved more in the community and looking to do a diaper drive or a bottle drive, look to Revive. It's a good ground to sow into. And our doors are always open to receive those products for our moms. So that's one way that members in the community can continue to support us, because it does take a village. And unfortunately, when you're a nonprofit, a smaller nonprofit, you don't get the big bucks. And so you got to stretch that dollar and make it work and make it do what it do. And we've been successfully and been able to do that for 3 years, but we always need more help. In terms of our referral process, you can email us at revivechc@gmail.com. And in the subject box or whatever, just put referral and send us the mom's name, contact information, how many weeks. She must be 30 weeks or under to be a part of our program. And one of my amazing, hardworking team members will reach out to you within 48 hours, reach out to that mom within 48 hours to explain to her the program and to get her enrolled. And like I said, all of our moms are individually assigned a life liaison to help make sure that they can matriculate through the program properly and receive all the benefits that come with it. So if you all know any pregnant moms, we do currently have open enrollment. It is completely free to our moms, and they receive a great benefit of being a part of our village. We'd love to serve them.
Thank you.
I think for me, I'm always getting fussed at by my mom and my daughter because when I don't have therapy openings and there is a need, I find one. And so if you call the office and they say she's not taking referrals and you know a mom that is struggling with what we call postpartum, you know a mom that has went to the doctor and she is just having a time with her OB, reach out to me. I'm on Twitter, I'm on Instagram. I put my number up there. It is important to me to find time because I was a child welfare worker when that happened to me. I knew the language. I knew what was going on. Unfortunately, I had a Blue Cross card that I was able to provide, but everybody is not able. And so while I'm a therapist, I'm also a community resource guru and I'm an advocate and tailoring this answer specifically to a med student. I know that you're, a guest in their facility, but call out those disparities when you see a doctor that's not listening to a mother, when you hear the doctors in the back saying, oh, she's just the welfare, she just has Medicaid. I've worked in a hospital, I've heard it. Call it out and make sure that you are strategically putting yourself in hospitals such as those in Flint, such as those in Genesee County, with the data that Katrina and Dr. Dotson provided. We need those who are not afraid to come into our community and say, we are going to break this public health crisis right here, right now. We can do so much with the resources, but it starts with those doctors. When we go, some of the data says 2 to 3 times, some cities is 3 to 5 times. We need to get that number down for Black women who are dying in childbirth without a voice, without an advocate.
Thank you. Thank you. Dr. Dotson, do you have anything else to add?
I would just say that just spreading the word. If you want to get in touch with me, if you want to stop by MSU, if you can call me first and let me know that you're coming down, we can put together a packet for you. And that packet will have, thought I had one around, we'll have a large poster. It'll have rack cards. It'll have possibly one of our little teddy bears, which the teddy bear's name is Rex. You get it? RX, Rex. So yeah, so all you got to do is just let me know because we want to get this material out everywhere, wherever it is. And if you already have a connection with a doctor's office who works directly with pregnant moms or Job Corps, I know they used to have a child care center and moms there. I think some things have changed, but that might still be a place. So if you have places and you can drop some materials off to some of these locations, or you're having an event and you want us to come to your event and set up a table and bring bags, we would love to do that. We have to do this as a community. And me and one of the youth did an interview earlier on TV5, and to hear a young person say, we just need our village. I was like, oh yeah, that's good. Because you usually just hear the seniors and older people say that. But she said village is important, and having that village concept, those people wrapped around you, it truly does help from a youth perspective to moms with new babies and to our seniors and our other most vulnerable populations.
Thank you. Thank you. I'd like to direct everyone to the chat and to our survey and ask that you fill out the survey. This has been such a wonderful presentation. I'd like to thank all 3 of our presenters, our community resources that we have in the city of Flint. Those women who have their finger on the pulse of this crisis in our community. I want to thank you for your time and your attention, and I would like to direct the spotlight to our illustrious president of Delta Sigma Theta Sorority, Flint Alumni Chapter, Tamar Swain, to close us out.
Thank you, Deirdre Scott, my soror. I appreciate each and every one of you. This has been action-packed for me. My heart is palpitating right now because this is what it is all about. I heard a lot of things resonate with me tonight from 3 of our esteemed, speakers and subject matter experts in our community. And one was about feeling worthy. our young women do not feel worthy to ask questions, to advocate for themselves. That is a huge issue in our community amongst our young girls and young women. And so, what I would like for you to do as an attendee of this webinar is a call to action. You can ask, what can you do? All you need to do is share this powerful information on your Facebook page. I know a lot of you spend a lot of time on Facebook and Instagram. Just click the share button on this webinar once it ends and share it amongst your network. Share it amongst your colleagues, your family, your friends. And it does not matter how much money you make. We are discriminated against on every sector of our salary range. So please do not think this is just for young women who are less fortunate in regards to their financial situations. This happens to educated Black women, these disparities. So please spread the word. This is a critical epidemic in Genesee County area. And I would like to thank our moderator, Sora Scott, Deidre Scott, Katrina Tillman, Dr. Morgan, as well as Dr. Dotson for your dynamic, powerful information. I'd like to thank our Health Awareness Chair, Mian Stubbs, our Technology Advisor, Jasmine Hall, and all of those who have attended this program tonight. Thank you so much.